Hello, hello, hello. Hi, everyone. I hope everyone is doing wonderful. So, today we're going to start with our CNA class part 3. Okay. So, before we start, okay, I'm going to go over some things, okay, that you guys must follow. Okay. There's no ifs or buts. Okay. For example, the most important thing in nursing is hand washing, okay? So, yon nan bagay ki pi important ou suppose lave men ou. When you do that, ou ede prevent bacteria, okay? So, you need to keep in mind, pasyen sa yo ki wap teke ya, some of them are very fragile, okay? Gen pil nan yo ki fragile. Genyen, okay? There are some of them that have very sensitive skin. Qui veut dire que l'autre manye moun nan, pas manye moun nan en genre rough, okay? Now, each time you perform an activity, it's very important that you take out your gloves and you wash your hand with soap and water. And then afterward, you dry your hand, okay? Like we spoke last time, all right? Communication, okay? When you are speaking to a client, be clear. Don't speak too fast, okay? Speak gently and softly, okay? Moi, dis nous comme ça que l'on a parlé ensemble avec un patient, pas parler vite ensemble avec moun nan, okay? Make sure que vous parlez clair. Eye contact, okay, is very important, okay? Li très important, le ou parler avec moun nan, ou gade moun nan nan yeux. Good morning, Mrs. Casey. Ou bien good morning, Brenda. Si moun nan do ou karele Brenda, then it's okay for you to call that person Brenda. Okay? It's always polite to ask the person, how would you like to be called? Okay? Would you like to be called Mrs. Alexis or just Brenda? Okay? Avec sa moun nan confortable, Labdiu, okay? Now, we're going to go over some of the questions, okay? And you and I are going to go over them together, okay? There are some questions that are on the test, okay? They are critical thinking, all right? C'est bagay plus common sense, all right? Gen kek question ke ou ka trouve nan examen, c'est pour tester knowledge you, to test your knowledge, to know how well that you know what you are doing, okay? So we're going to start with the first one. Okay. All right. Number 1. Rehabilitation care after any injury should begin when? Okay. Nous connaissons que rehabilitation, c'est rehab. Okay. So you do penser que rehabilitation care after any injury should begin when? Is it A, when patient enter rehab program? Or B, 1 week into recovery? Or C, as soon as possible? Or D, when the doctor says so, okay? Now, to better understand this question, it's asking you, okay, what is the best time, okay, for you to start rehab, okay? When should you start rehab? Okay, after you get injured, okay? In other words, après que ou blessé, après que ou fracturé, qui lè ou supposé, qui bon moment ou supposé commencer rehab? Is it A, when the patient enter rehab program? B, 1 week into recovery? C, as soon as possible? Or D, when the doctor says so, okay? Now, if you look at this question, the best answer is D, okay? No, the best answer is as soon as possible, okay? Now, si ou son moun ki fait stroke, ou pas besoin tant pour docteur a dit kon sa que ou supposé al nan rehab tel le, non? It's very important for you to start as soon as possible. Because the later you wait, the worse it is for you to get better, okay? Plus tant que ou prend, moins chance ou gagne pour ka refaire tout encore. So, anytime after an injury that you have to start rehab, you have to do it as soon as possible. Now, we're going to go over the answer why A is not the correct answer, okay? Now, ayant dit comme ça que les ou ka commence rehab, okay, c'est les ou entrer dans programme nan, okay? Et s'il prend 1 an, et s'il prend 2 ans pour entrer dans le programme, so does that mean that's when you're going to start? Li pas bon. So, plus vite, c'est plus bonheur, c'est plus grand matin, ok? Plus vite ou commence en rehab, après un événement, c'est plus chance ou gain pour carré faire. So therefore, A is not the correct answer. All right? Let's look at B. 1 week into recovery. So, qui veut dire que 11 semaines avant que vous commencez par le refaire, c'est laisse au bras dans rehab. Non, il n'est pas bon du tout. OK? Ou supposez commencer d'avance. Les bagailles l'ont show up. Tant que Haïtien on dit as soon as possible. That's the correct answer. And if we look at D, D say when the doctor says so. No, it's not the correct answer. This is what I want you guys to keep in mind, okay? When you are taking the board test, okay? Wap jwen an pile réponse that are good answer. But keep in mind, they are not looking for the good answer, but they are looking for the best answer. Okay? Now, on dit que si c'est à pat là. Okay? On dit que si c'est à pat là. Si c'est à pat là, oui, ou te ka checker ça. Si c'est à pat là, then ou te ka checker ça. But if you look right here, bien moun ki t'a choisi ça. Oui, that's a good answer, but this one is the best answer, okay? Now, le wap pran examen, wap pran pile question qui fait sens, but keep in mind, yo pa cherche un bon réponse, they are looking for the best, okay? So, we're gonna go with number 2. I'm gonna read the question for you, and then you're gonna write down which is the correct answer. Number 2, a resident is having difficulty chewing regularly meals at dinner, okay? Chewing vle di moustike, okay? When you are chewing your food, lo moule manger, okay? A resident is having difficulty chewing regular meals at dinner. Which of the following diets might be suggested to order for next time, okay? Now, if your patient is having difficulty chewing on a regular basis, okay, his or her normal meals, okay, what is the best thing for you to do next? Okay? Is it A, should you provide a liquid diet? B, puree? C, soft? D, hard? A resident is having difficulty chewing regular meals at dinner. Which of the following diets might be suggested to order for next time? Is it A, liquid? B, puree? C, soft, or D, hard? Now, I want you guys to write down number 2 and then the answer. Okay? Write number 2 and then tell me what do you think is the correct answer. Okay? If your resident is having problem chewing his or her meals at dinner, which of the following diet might you suggest next time? Is it A, a liquid diet, B, puree diet, C, a soft diet, or D, a hard diet? Okay, so you're gonna write down number 2 and then the answer. Okay, so if someone having difficulty chewing his or her food, okay, what kind of food would you suggest for next time? That's exactly what they are asking you. All right, is it A, a liquid diet, or B, pureed, C, soft, D, hard? So maptanou, so write down number 2 and then the answer. So I've noticed some of you guys write puree. Puree is not the correct answer, guys, okay? This is a good answer, but it's not the best answer, okay? Now keep in mind, mwen di nou kon sa ke, wè tout bagay, everything that you are doing, you do it step by step. Okay? Now, si moun nan gen difficulté pou l ka manje, ou pa ka sote soft pou vin tombe nan puree. Because number 1, did you try soft food? Maybe the reason why moun nan pa ka moustike manje l bien, li gen un problem nan dentures lan, you never know. So ou pa ka, a cause moun nan pa ka chew food nan ou get envole nan puree. You have to try the soft diet first, and then if that doesn't work, then you go to puree. Okay? Then si sa pa marche, then you go right here. Okay? Now, keep in mind, that's not the correct answer. That's not good. The reason why this is not good is because Si moun nan get difficulty, okay, pour le why are you giving that patient hard food? That's not gonna work. You're making it worse. Okay? Now, patient déjà. Okay? This client is already here. Okay? So if this is not working, your next jump should be here, not here. Okay? So the best answer is C, soft. Okay? The correct answer is C, soft. Then, C, soft diet doesn't work, then you can go to puree. All right? Number 3, the nursing assistant cares for a client with AIDS. Okay? What is AIDS? AIDS is acquired immune deficiency syndrome. Okay? C'est li men en bon créole ou le sida. All right? The nursing assistant cares for a client with AIDS. The nursing assistant knows that AIDS patient require what kind of precautions? Okay? Another word, ou même comme nursing assistant ou prend soin yon patient qui gen sida. Okay? What kind of care do you think that patient require? A, respiratory. B, standard. C, droplet. B, contact. Okay? Qui montre des précautions pour faire ensemble avec patient ça? Is it A, respiratoire? B, standard? C, droplet. Droplet là, c'est un coup que si m'get tuberculose, ok, ou ap obligé mettre masque pour protéger visage ou parce que si m'a parlé cracher ka voyer, ok, tout bagay ça c'est ça les droplet la tears, anything liquid. All right? Is it B, contact? Okay? So, you're going to write number 3 and then the answer. You as a nursing assistant, okay, is caring for a client with AIDS, okay? You know that as a nursing assistant, the patient require what kind of precautions care? Is it A, respiratory, B, standard, C, droplet, D, contact? So, the answer is standard precaution. Okay, very good. Number 1, that's not the correct answer because le moun nan gen sida, même si moun ap espire, même le ensemble avant, moun nan pa ka ba oul. Okay, so therefore it's not respiratory. I can be in the same room with someone that have HIV or AIDS. That doesn't mean I'm gonna get it. So therefore it's not respiratory. Okay, let's look at C. That's not the correct answer neither, okay? Pa go kin bagay de droplet la so they automatically di pa bon. B is not correct, okay? You can have HIV, I can touch you, that doesn't mean I'm gonna get it, okay? So the best precaution pour faire ensemble avec moun nan, it is standard precaution, okay? And you know, keep in mind, lor travail nan nursing, ou supposé traiter toute santé kou yo contagieux. I don't care sou konnen moun nan gon maladie ou bien pas gon maladie, tout bagay sa yo global, okay? You treat blood like it's infected. I don't care sou konnen patient personnellement ou bien pas konnen, ou traiter tout sans même gens, okay? Standard precaution. Next, number 4. The nursing assistant knows that the term pulse deficit refers to what, okay? Now, before we continue with this question, does anyone know what is the word deficit? Who can tell me what the word deficit means? Before we continue with number 4, can someone tell me what does the word deficit mean? Ki sa mot deficit nan vle di? What does it mean, deficit? Mwen pa vlo moun traduil pou mwen, I want you to explain to me what it means, okay? Gen yon gran diferans lon moun ap traduil bagay pou lè la espliko li, okay? What does the word deficit mean? The nursing assistant knows that the term pulse deficit refers to what? What does the word deficit mean? Who can tell me what the word deficit stands for? Very good, Tati. Deficit bledi not enough, okay? It means deficiency, okay? Déficit, not enough, pas assez, okay? Or deficiency, all right? So this question is telling you, you as a nursing assistant knows that the term pulse deficit refers to what? A, the difference between apical and radial pulse. B, a strong pulse. C, the difference between systolic and diastolic blood pressure. D, absence of the pulse. So what is the correct answer? Martin nous pour nous dire what is the correct answer. The nursing assistant knows that the term pulse deficit refers to what? A, the difference between the apical and radial pulse. B, a strong pulse. C, the difference between the systolic and diastolic blood pressure. D, absence of the pulse. So you're going to write number 4 and the answer. You as a nursing assistant knows that the term deficit refers to what? Is it A, the difference between apical and radial pulse? B, a strong pulse? C, the difference between the systolic and diastolic blood pressure? If we're talking about diastolic or systolic, diastolic veut dire ça en bas, down, systolic veut dire numéro qui en l'air. Okay? Or absence of the pulse. What is the correct answer? What is the correct answer for number 4? Ok, moi gen moun ki ekri D, gen moun ki ekri A, gen moun ki ekri D, gen moun ki ekri C, okay? The correct answer is A, okay? And I'm going to explain to you why is it A, all right? Le palo de apical pulse, okay? What is that? Se le ou pran stethoscope ou mette sous l'estomac moun nan, ou ap tan de heartbeat lan, okay? That's the apical pulse, okay? The radical pulse, okay, the radial pulse, they are talking about your wrist. Okay, this is your radial bone. Okay, that's your radial bone. Ou besoin prendre wrist moun nan, ou pas jamais utiliser droite ça. Reason why? Because your thumb has a pulse itself, so therefore you cannot use that. Okay, you can either use any of these fingers except for that one. Okay, so l'on prend droite ou mettez ou prend pulse moun nan, okay, that's your radial pulse right here. Qui veut dire que yo tout kon sa que différence between your apical and your radial pulse. Lo calculer difference, okay, when you taking the pulse using the stethoscope and when you using using your radial pulse, okay, lo compare différence sa yo releli pulse deficit. Take note. Et ça pulse deficit l'anglais dit. When you use the apical pulse, okay? When you use the apical and the radial, okay? L'on compare tous les deux ça ensemble, les vient égal à pulse deficit. C'est ça l'anglais dit when they talking about pulse deficit. Okay? Now, let's look at B. A strong pulse? No. It has nothing to do with that. So we already know B is not the correct answer. If we look at C, the difference between the systolic and diastolic blood pressure, ça va avoir aucun rapport avec pulse. This is talking about blood pressure, okay? So, absence of the pulse, no. Li pa ka absence of the pulse because l'on met mon là, okay? Ou ka tan de pulse moun nan, so therefore, ou deja konen D is not the correct answer, alright? So, the answer is A. The difference between the apical and the radial pulse, okay? When you compare the two, it equal to pulse deficit, all right? Number 5, which of the following is an example of nonverbal communication, okay? Which of the following is an example of nonverbal communication, okay? Is it A, whisper, B, hand gesture, C, mouthing words, D, minimizing facial expressions? Which of the following is an example of nonverbal communication. Now, ou même qui ont une question qu'on s'appelle devant, try to figure out what is nonverbal communication. Okay? Now, we know communication veut dire pour communiquer. Okay? There are different kinds of communication. Okay? You have verbal, you have nonverbal. Okay? You have emotional, ou get tout bagay sa. Ok? Question ça lui même dit tout pour ça que qui est-ce qui fait exemple de non-verbal communication? A. Whisper. B. Hand gesture. C. Mouthing words. Ok? Mouthing words veut dire mot qui sorti dans bouche. Ok? D. Minimizing facial expression. L'on whisper veut dire comme ça que l'on souffle, on parle dans les oreilles, on monde. That's called whispering. Okay? So what is the correct answer? Moun qui mette a yo, you, come on. Moi dis nous whisper, c'est l'on dit on ti cause tout petit dans les oreilles moun nan. So that's not non-verbal. Non-verbal veut dire on bagay qui pas verbal. On parole, on communication qui pas require pour ouvrir bouche, ok? Regardez tout le monde qui sous tableau, which is the correct answer? Parce que ça, pour qu'on whisper avec on est pour ouvrir bouche pour parler. On va parler tout petit dans les oreilles moun nan. That's called whispering. So we know that's not the correct answer, okay? This is hand gesture. This is mouthing words. This is minimizing facial expression. The question is asking you for non-verbal communication. What is the correct answer? The correct answer is B, hand gesture. Okay? That's the correct answer. On après, tout notre n'est pas bon. Où est ça? Minimizing facial expression, ça veut dire que on minimiser, j'en exprimer avec figure, même si on minimiser, ou style à parler. So therefore, moi ça, ok? Mais ça tout est moi ça, ok? Si minimizing n'a pas là, ok? Et puis, hand gestures n'a pas là, démouté qu'à dire c'est ça qui correct answer, ok? Again, take your time when you are reading. Sometimes this is how they trick you when you guys are taking tests. Okay? Yo fourré yon mot que yo konon pas connaît ou bien pas penser bien et pour dire comme ça wow, gesture, let me choose that. No. More minimizing non c'est ça craser réponse ça. S'il pas de minimizing non, yes, ou te dire that's the correct answer, all right? Number 6. A typical blood pressure around the upper arm should not be taken around a patient. Okay? A. Complained that this is the 5th time today. B. Has had lymph nodes removed around axilla left arm. C. Has IV catheters in both the left and right arms. D. Has heart failure. Okay? Pour qui ça ou pas supposé prendre tension yon moun? Okay? That is what the question is asking you, okay? A typical blood pressure around the upper arm should not be taken around a patient. Why? Okay? Gade yon nan réponse sa yo pou wè ke pour qui ça ou pas supposé prendre tension nan bras yon moun ki gen tel bagay. Tell me which one is it? Is it A, when a patient complained that this is the 5th time, okay, his or her blood pressure has been taken today? Or B, has had lymph nodes removed around axilla left arm? C, has IV catheters in both the left and right arms? D, has had heart failure. Qui m'a des patients ou pas supposé prendre tension yo, ok? Est-ce que c'est patient qui a un problème cœur? Heart failure. Okay? Is it patient that, est-ce que c'est patient qui a plein, ça fait 5e fois, oui, ou prend tension aujourd'hui? Ou est-ce que c'est patient qui a left nodio, il retire left nodio around axillary left arm, okay? Dans axillaire, point gauche. So what is the correct answer? A typical blood pressure around the upper arm should not be taken around a patient with what? A, that complains that this is the fifth time today. B, has had lymph nodes around removed around axillary left arm. C, has IV catheters in left right arms. D, has heart failure. Very good. The correct answer is C. OK? Pour qui ça dit C? Ou pas juste besoin qu'on ait réponse là, ou besoin qu'on ait que pour qui ça c'est telle réponse, and I'm going to explain to you, OK? The reason why, les gens patient qui get IV catheters dans left arm ni, you never, jamais pour prendre attention moun ça, reason why parce que in the insert site, OK, commencement côté IV line nan bagay la ou ka créer un blood clot ou ka faire vin former un blood clot. OK, si moun sa vin former un blood clot, moun sa est tué ou ap tué. So therefore ou pas jamais prendre attention yon moun qui gon IV line. OK? Keep that in mind. Et je dis à m'expliquer pour qui ça. Soit elle fait ça, OK? Ou ka cause moun nan vin form thrombus. OK? Thrombus blood clot, thrombotic, however you want to put it, okay? And that can cause serious problem. So anytime you see a patient has a catheter IV line, pas prendre attention à point ça, okay? Next. Number 7. In the event of a fire in a client's home, your first action is to what? A, move the client to a safe place. B, get the fire extinguisher. C, call the supervising nurse. Or D, turn on the fire alarm. Okay? In the event, okay, of a fire in a client's home, your first action is to what? Okay? Gen pil nan nou gen difficulté lè ou pose nou question, what should you do first? Okay? On dit à nous du fait quand un patient qui va prendre soin patient, qui premier bagay que tu as fait? That's what this question is asking you. Okay? Est-ce que tu as move patient en côté qui safe? Est-ce que c'est premier soit tu fait? Ou bien est-ce que tu as pris fire extinguisher pour tuer du feu? Ou bien est-ce que tu as pris les supervising nurse là en premier? Ou bien que est-ce que tu as parti fire alarm first? So what is the correct answer? In the event of a fire in a client's house or in a client home, your first action is to what? A, move the client to a safer place. B, get the fire extinguisher. C, call the supervising nurse. D, turn on the fire alarm. Very good. The correct answer is move the client to a safe place. Think about it, okay? This is what I want you to keep in mind. Get quelques règlements ou ka fait dans nursing home or hospital, li pa appliqué pour un patient qui la kaili. Okay? Now, si du fais c'est non facility li the first thing you need to make sure you would close all windows, you would close all doors, and then afterward you listen for instructions. Okay? Now, c'est un that's a different scenario, so you have to use critical thinking. Okay? Premier ça pour faire, c'est pour make sure que le patient soit safe automatically. Okay? Then, l'autre fait ça, then on can prendre fire extinguisher. Okay? Pour faire ça. When you buy a fire extinguisher, so where du feu is getting out of control, ça veut dire que si ouais du feu a commencé à exagérer côté que ou pas qu'à contrôler, yes ou supposé pour le fire alarm là, parce que c'est pas patient ça qui rete, patient qui doit rester dans le building. OK? Keep in mind, so ouais du feu a commencé à get worse, ou pas besoin l'autre patient l'autre monde mourir dans du feu, OK? Now, so ouais ou ka contrôler du feu, après ou fin make sure ou mettez moun dans nos location qui safe, oui, ou pour fire alarm now. Okay? Now, on dit que du fait a commencé à exagérer. The fire is getting out of control. Your next thing, okay? My patient is safe. Then I tried the extinguisher. The fire is getting out of control. My next thing is I'm gonna put the fire alarm, and then afterward I'm gonna call my supervisor. There's a fire at such and such house. Yes, ou supposé reporter ça. Okay? Pour yo connaître, okay? Now, si c'était dans un nursing home, c'est pas ça t'as fait. Okay? Keep in mind, gen différents côtés, pas penser que tout bagay pral appliquer même gens. That is why, gen pile nan question que yo mando yo, okay? Ou suppose li question perfectly. Question ça y a mando là, est-ce qu'elle applique pour un patient qui est dans Kylie ou bien est-ce que question appliquée pour un patient qui non facilité? Okay? It's not the same thing. Okay? Now, rehab, c'est côté que pour yo make sure it's a rehabilitation center. Côté yo edo ou même qui fait stroke, okay? Ou même qui font accident, you have to start rehab immediately. Ou pas tant 1 an, ou pas tant 2 ans, ou pas tant 3 ans. Think about it. If you have a stroke, okay? Et bon droite la paralysée. On l'autre question que aucun joue dans bord l'entou, okay? Si on moun gen on paralyse, if a patient has a paralysis on the left side, qui bo moun nan fait stroke là? Keep in mind, moun nan fait stroke là nan bord droite là, c'est bord gauche là qui gen problème. Si c'est nan bord gauche là li fait stroke là, c'est bord droite là qui gen problème. Yon patient qui fait un stroke, wap habiller moun nan, the first thing you need to do is to make sure bo qui pas bon, bo qui pok là, c'est li même rentre mais l'avant. Ou bien si c'est pied, quel que soit bo qui affecté, c'est li même ou utiliser en vent. Laissez déshabiller ou déshabiller moun nan, bo qui bon, c'est li même ou use avant, okay? Your patient had a stroke and you are dressing that client, say I'm putting shirt on the client, I'm gonna use the bad arm, okay? The bad arm goes first, then the good arm. If I am undressing that client, I use the good one. The good one comes out first, and then the bad one comes out next, okay? Now, keep in mind, when you are using an equipment for the first time, ask question, okay? Le wap utiliser yon équipement pour première fois ou supposément des questions. Même si vous pensez que vous connaissez bagay là, sometimes j'en pense ou connaît là, c'est pas qu'on s'en connaît. Especially if you are using something for the first time, okay? When you are using Hoyer, qui ça Hoyer? Hoyer is a lifter, okay? Gen patient qui pas ka camper, gen qui bedbound ou bien gen qui sous wheelchair, gen que à cause de grosseur, you're supposed use a Hoyer. Si ou pas jamais utiliser un Hoyer, it's better for you to ask question, okay? Pas quitter un CNA ou bien un nurse du comme ça que come on, it's you and I, let's do it. No. So qu'a dit infirmière là, I've never done it before. So why don't you do it with another CNA or with another nurse while I watch and then I can try it? Because guess what? Si wal fait ou pas quand so à faire, patient vient injure, c'est licence ou qui n'a problème. Infirmière pas jamais dit comme ça c'est lui même qui te force non? Keep that in mind. Et ça fait yo du comme ça que knowledge is power, okay? Ou supposé étudier toute question yo, okay? Li pas un problème. Gen quelques bagay on nurse ap mando ou ka dil non. Okay, as a CNA, you don't give medication. Ou pas ba médicament. Même si n'est pas du comme ça que oh, bay tel patient ti médicament pour moi m'a vini. Non. I'm sorry, but it's not part of my job description. Li pas fait partie de notre travail yo. On dit que ou bay patient médicament vrai. Li gon adverse effect. Okay? Côté que commence à vomir ou bien à prendre son bagage. Guess what? Your license is on the line. Okay? Sous travail du pour qu'a prendre licence, pour qu'ils soient pas perdre pour l'autre monde. Même gens infirmière essayer pour protéger licence li, you should do the same thing. All right? And keep in mind, on monde ou nan problème avec un patient because of abuse, pas aucun côté qu'a prendre. Okay? Now, nous connaissons sometimes there are some patients they can really test you. And this is what you do. If you feel like you are overload, it's okay for you to step out, take some fresh air. Pas aucun problème. Peut-être ou t'es qu'à venir non jou côté que patient vraiment commence à énerver. OK? Au lieu pour jouer moun nan pour éclater sur moun nan, ou dit I'm sorry Miss Casey, give me 5 minutes. I'm going to take some fresh air. Ou ka même di supervisor la sa tou. You having a hard time, yo pa ka revoke ou. Ok, se email ou ye. Yo pi bien content de fact that ou prend ti temps pour al calmer ou, que si se éclate sou moun nan. Okay, now you walk into a patient's room, okay, and you have to do personal care for that client, and you notice there are marks or there are bruises. You don't touch that client, okay? You tell that client, I'm gonna be right back. You go get the nurse, okay? Make sure nurse lan ka wè bruise ki sou patient. M'pa ke même si c'est ben wap ben yon moun, etan wap ben lan ou vin ou mak, ou pa kontinye fin ben moun nan. Cause keep in mind, gen patient ki wap di lanseman ve yo gen dementia. Okay? There are some qui gen delirium. Tout se bliye oubliye. Okay? Qui veut dire que ou wè on mak ki pat la, ou di moun nan konsa ke I'm gonna be right back. Si patient san dan top la, ou pas suppose kite l pou kont li, pour aller nurse la. What you do is you pull the call light. Yes, the call light is not only there for the patient, it's there for security. Même ou même as a CNA, wap prive on le nan view, wap use it whether you want to believe it or not. Si wap transfère un patient, et puis avec un CNA, et puis CNA a un problème, il pral tomber, what are you gonna do? Wap kite ni CNA avec patient tomber, ou bien que call light la bokoto wap pese pour l'autre CNA ou bien l'autre nurse, vine do. Qui veut dire que c'est pas pour patient seulement là. It's here for safety. Gen quelques questions yo pose, the reason why yo pas de bon licence là is because ou pas qu'on a des safety. OK? Safety fait partie que lorsqu'on est à terre mouillé ou suppose à changer patient dans chambre là ou pas traîner patient tout on pas make sure à terre sèche. That's safety. Ou connaît que when you working overnight, même si patient dans chambre pour compte li, ou suppose qu'ils ton ti lumière because there are some patients that are independent, they go to the bathroom by themselves. But if you leave that client all dark in there, et puis moun nan saute tombe, guess what? That's safety. And before you leave, okay, after providing care for a client, make sure that call light is within reach. Okay, within reach, non, ça veut dire que call light là supposé on côté moun nan ka use li. That's safety. Okay, wap fon patient, wap retire son cabane, ou better make sure break cabane is intact. That's safety too. Okay? Now, les pose aux questions de privacy, safety fait partie que manger ou pral servi moun nan. Si moun nan, c'est un moun que li gen edema, yo voyon mauvais manger en l'air, ou même ou pas kon ki sa potassium, ou pas kon sodium, you don't know carbohydrates, you don't know none of that. Même ça observe moun nan ou ka touye l tout, so that's part of safety too. Gen quelques symptoms on moun a bay ou suppose qu'on est là pour transférer moun nan ou bien là pour pas transférer. That's part of safety too. If I'm getting a client up in the morning and the client is telling me, oh, I don't feel good, I feel dizzy, guess what? Even if I have to transfer you from the bed to the chair, I'm not gonna try it. Because while I'm trying to get you up, you can collapse on me and you can fall. That's part of safety. Et puis tout, on l'autre partie de safety tout, gen pile moun ki pa connaît, okay, patient yo. Especially the one that are independent. Okay, les on a chambre pour compte yo, sometimes they have magazine. They will take that magazine and put on top of the heater. Guess what? As a CNA, ou suppose qu'on est, si pou vire de malé en après magazine, ça prend différent heater. Okay? But sou pa ge common sense pour retirer magazine nan. Ou pense board nan pral bon licence ou pa ka use common sense ou? That's part of safety too. Pa di that's not part of your job description. Your job is to make sure that the patients are safe and you and your co-workers are safe as well. Si nan pale de privacy vle di que before you enter a client's room, you have to knock. Okay? Because think about it. They are not in their home. So you have to make sure you make them feel comfortable. L'on kote ki pa la kayou ou pa à l'aise. Part of making that patient feel comfortable is try to introduce them to other clients in the facility. Okay? If you know that the patient is in the room by themselves, maybe they might be depressed. Why don't you offer them activities? Ou pote schedule ou di, listen, they have activities at this time. Même si moun nan ka li pa di kon sa, oh, the patient can read, I'll just give it to her. No. Li pi bon, oui, laisse ou kap explique moun nan, guess what? Même si moun nan te gon ti problem ki tap trakasel, the fact that you give that patient 5 minutes, ou fe problem nan ale, ou vin reconforme moun nan. And part of privacy is to make sure I don't care if you're the only person in the room. Okay, you finish doing the top, you dry them, you doing the bottom. Make sure you cover the patient. Make the patient feel like she or he has dignity. Ou pa ka fon moun an apò ki tel tout exposé kon sa. The same way you wouldn't want someone to do it to you, why do it to them? So that's part of making sure that moun sa get privacy. Privacy have something to do with yo poton mail pou moun nan ou frappe pot la ou di, Mrs. Casey, you have a mail for today. Here. And even if that patient is not here, you put it inside their drawer. There's nothing wrong with that. It's called privacy. Ou pa ouvelet moun nan. Esko tap aksepto moun ouvelet ou? Okay? On party privacy. Okay? The patient family or a patient's neighbor come to a facility. Oh, I'm sorry, Tati. Do you know if Mrs. Adams is getting better? Is she able to walk now? No, you don't give any description. I'm sorry, why don't you see her nurse? She can give you all that information. Okay? Because that patient is entitled to his or her privacy. Maybe she didn't want the neighbor to know that he or she is in the place. Peut-être li pat vle moun konnen sil nan place lan. Okay, someone called. Hi, I'm calling to find out if my aunt is walking. Can you give me 1 second? I'll get the nurse and she can talk to you. Lo fe sa ou pa di si moun nan la ou pa di si moun nan pa la. It's part of privacy. Part of privacy is making sure that whatever it is you're doing, make sure ou rale curtains an. Okay? Si wap prantes board lan and you doing the clinical, ou pa ka fe jes ou rale curtains an, yo pa pase ou. Because you're deja konnen ke ou pa kon koman pou bay an moun privacy. Part of privacy is patient indépendant. Okay? Ou pa bezon reten de toilette lansam avel. Ou ka dil kon sa ke, Mrs. Casey, I'm right outside the door if you need me. Okay? Now, pendant rete de airport la, ou pa ptan pousse moun nan dou kamen, on ti tan ou ka fon ti frappe, are you okay, Mrs. Casey? It's called common sense. Pendant moun nan chita, moun nan ka tou moun nan toilette la ou pa konnen, men ou men mou rete inet tan wap tan moun nan fini, ou pa ka bagay. Gen kek question yo mando, it's called critical thinking. Pou pense kritikman. Okay? A patient is having a seizure. Nurse la pa nan cham nan, what is the first thing you do? Ou pa kouri kite patient sa pou kont li pou al rele nurse la. You stay with that patient. If you think like there are dangerous things around that patient, ou retire tout bagay ki pou cause harm to that patient. Et pour make sure wap gade la terre, pour make sure pour contrôler combien temps li fait avec seizure ça. Because it's very important. Les nurse lan vini, ok, ou pa kite client lan non, wap rete ensemble avec. Pendant nan chambre nan, wap pese call light lan, on CN ka vini ou be a therapist or whatever it is. When the nurse arrived, wap di nurse la, yes, Mrs. Tracy had a seizure. It lasted for 2 minutes. Li important pou nurse la kon sa. Mais, sou pa use critical judgment ou just kite moun nan la. Ki so fe la? Peut-être lor vire do kite moun nan ka si, jiska se la l fwa peut-être li an apel touti etet li ou bien something can happen. Critical thinking. A patient is telling you, I'm very depressed. Okay? The fact that patient do, I'm very depressed, you don't leave that client unattended by him or herself. Ou pa kite client sa pou kont li. Parce que li dou li dépressive. Ok? Qui veut dire que même pas ça ka tuer tête li, il ka fait qu'il n'importe bagay. On moun qui dépressif, qui sont pral essayer faire ou pral essayer pour bagay créer activité pour lui. Même si gen 12 patients dans une journée, ouais patient ça, li supposé number 1 dans mind. De temps en temps, si gen 1 minute pour se faire, al checker sou client ça. Et ou pas jamais quitter dans chambre ni pour compte li tout. Talk to that client. Pas dire comme ça que oh, why are you depressing? Okay, ou ka dil kon sa ke, what's making you feel that way? Is there anything I can do to help you, this and that? ou essayer introduire some activities, things like that. Because guess what? Peut-être moun sa ka depressed parce que pas gen moun qui vin well. Think about it. Kunya, okay, you are able to do whatever you want. Let's say tomorrow something happened. You ended up in a nursing home. Your family don't come and see you. You all by yourself. Okay? Now you used to do everything by yourself. Daily care, whatnot. Now you having a stranger taking care of you. Put yourself in that client's shoes. So you would be depressed too. So, on moun ki kito pour kontou. Moun sa etuye la l'tuyo, oui. So, c'est common sense ça, state là, attendre nan moun. Et ça fait que quelques questions ou dit au konsa que, oh, m'pa ta prendre l'école, non? Et pas tout bagay wap prendre l'école. Gen bagay c'est expérience la vie ou bien common sense. Ok? Même gens tout soutenir en situation, t'as blon moun, la pour un moun nan bon bet, you expect même bagay la in return too. Ok? Another thing state là, attendre nan moun tout. Ok? Now, gen patient qui vraiment tripote. Okay? They want to know everything that going on around the place. Yo vle konnen tout bagay, c'est comme ça yo ye. Lo konnen wap dil de mode de patient sa yo, ou pas supposé parler dans couloir. Parce que ou ka di on nurse on bagay ou bien on nurse on bagay ou pense que pas gon oreille captain do, guess what? Someone is listening. Et puis tout, bagay ke ou di an. Songez bien, moun nan ka nan l'âge, li pa tande bien. But moun nan al kozon action qui vin dangereux pour l'autre moun, qu'est-ce qui pral perdre licence yo ou même. So you have to be very careful and keep in mind, les ou son CNA, premier ennemi ou gen nan place ki wap travail c'est CNA pareil. C'est eux même qui ka aido kembe travail là et c'est eux même koutou qui ka messed up pour perdre travail là. Puis go jamais dépendre sur aucun nécessité pour dire comme ça que oh al checker tel patient pour moi m'pas gen temps faire tel bagay. Non chérie, it's your job, because guess what, if your patient have a problem, the state is not going to go after the other CN, they're going to go after you, because in the like nobody care plan aujourd'hui, you had to take care of that client. It's your responsibility, not your co-worker. Sou konnen ke ou pa tap gen temps pour faire, you should go right to the nursing station and tell the nurse, I'm sorry, I'm not going to have time to take care of Miss Casey. Okay? I'm kind of overload. Can another CNA help her for today? Sou fè sa on l'autre bagay. But if you don't do that, anything happen, you're responsible. Et puis, pas penser que nécessité qui cause passion l'entend tomber, li pral défend nous, because he or she have a license to care for themselves too. Qui veut dire que ou même capable prendre, même si on pas prendre CNA ou bien nurse, I don't care what it is, ou pas jamais as a nurse, ou pas quitter un CNA ennemi ou. CNA a messed up ou as a nurse. Trust me. And as a CNA, ou pas fait ennemi avec un nurse. Because think about it. Ou capable su que ou ta remen un nurse demain, but you never know in the future. Sometimes il est toujours bon pour suivre. You know why? You can get experience. You're gaining experience by watching. But si vous sortez pour fâcher avec toute infirmière this and that, you're not helping yourself, you're hurting yourself. When you're working in a place, you don't want to make enemies. Quand on travaille, ou pas besoin faire ennemis. That's the last place you want to make enemies. Because c'est comme ça tout. Son monde dit comme ça la mess up pour perdre licence ou li ka fait ça 1, 2, 3. So, I'm not going to keep you guys too long. So, next Saturday, we're going to go over the rest, okay? So, you guys did fantastic today. So, if this is your first time assisting me, my name is Myrdalyn. We meet every Saturday at 7 o'clock. So, ou même qui t'a remet prend kou CNA ou bien que ou al prend kou CNA ou pas ka passer bordou, relem sur WhatsApp 617 419 5381 ou même qui c'est un home health aid ou a besoin konnen bagay sa yo tout, okay? So stay positive, guys. I will see you guys next Saturday. Have a wonderful night. Bye-bye.